Bismillahirrahmanirrahim. Assalamu alaikum, respected audience. Today I want to discuss with you about a case of Pterygium who presented to my clinic with atypical presentation. We will discuss about its examination and possible management. These are the corneal slit lamp photographs of a middle-aged patient, 46 years old. And for a while, for a few years, he has been suffering from this fibrovascular growth, which we called pterygium in the eyes, right eye and the left eye. If you please see the left eye, the pterygium has got somewhat elevated bullous appearance. This is a somewhat atypical presentation. Usually the pterygia is on the nasal sides. Of course, this is on the both eyes, nasal side, left or right eyes. But you see that in the left one, it has got somewhat elevation, a bullous appearance. So this is a atypical presentation of pterygium. The right eye, which is shown here, here there is no fluid, nothing like that, typical routine presentation of pterygium. But in the left, the photographer has taken the appearance over there, the picture which is showing fluid over there. So there is a fluid present over there, which has been beautifully shown in the cross-sectional photograph. These corneal photographs, you can see that in the eye, the bullous appearance is on one side, nasally. But apart from this, it is also involving this fibrous growth inferiorly and to some extent superiorly. So this is atypical presentation. This is non-normal routine presentation of the pterygium, which needs further to be investigated, that whether this is a benign lesion or it has a tendency for malignancy. So this thing has to be kept in the mind. These are OCT anterior segments. Usually in such atypical presentation and even routine pterygium cases, we have to take the histology help. But here in these cases, when you have atypical presentation, OCT anterior segment, the imaging devices are very helpful to rule out the element of malignancy. That is it a benign lesion or it is going towards the malignancy. Especially when we talk about this, that the conjunctival epithelium is continuous with the corneal surface. There is no abrupt change over there on the cornea. And secondly, there is no deep penetration in the cornea. So these things go towards the benign element in these photographs. The one eye is showing us this elevated lesion, and there is a fluid which was shown on the photograph also. And but the other photograph, the other eye, as there was no such lesion over there, so the other eye, OCT anterior segment, is normal. This is the corneal pachymetry, which was also done. In the left eye, we can see that the corneal thickness has increased. It is in some areas crossing 600, while the right eye, there is almost normal corneal thickness. So this is the pachymetry photographs. We talk about routinely about pterygiums. These are usually fibrovascular growths over there in the nasal sides of the eye, along the limbus, and from the conjunctiva they encroach the cornea. And sometimes, usually, if we talk about the microscopically histology, the fibrovascular growth involves the Bowman's layer, but usually it doesn't go deep into the stroma. So basically, the people living in the equatorial areas along the where UV light exposure is more, they have a more tendency to develop these pterygiums. And especially, it has been said that mostly that nasal side of the is involved, that are because of the reflection of the rays, UV rays, which are hitting the nose and then affecting the eyes. So this is another hypothesis that usually the nasal side of the eye is involved. So when we talk about the examination of pterygium, it should not be taken lightly. The patient should undergo thorough examination, visual acuity should be done, anterior segment examination, and conjunctiva. When I talk about conjunctiva, I talk about bulbar conjunctiva along the limbus, and also I talk about the palpebral conjunctiva, that is under the eyelids. They have to be everted, they have to be seen over there, that there is any possible growth over there or not. Along with that, anterior chamber examination is very important. We have to see any iris abnormality, any deep lying structure, whether this lesion which is outside, is it penetrating deep into the eye, which can be seen with the naked eye. That is also very important. And above all, posterior segment examination, as no eye examination is complete without front eye examination, so it should always be done over there. So it should be taken not very lightly, and thorough examination, anterior segment, posterior segment. As I mentioned, we should, if possible, we should take help of the imaging devices like OCT anterior segments, pachymetries, all these things, extraocular movements, very important. Is there any limitation of the movements? All these things should be done. Okay, when we talk about the clinical presentation, I mean symptoms of the patient. He comes to the physician, the ophthalmologist, and tells that I have this growth over there. Sometimes it becomes red, inflamed. I have got irritation. I have got dryness in the eyes. These are usual complaints, and sometimes there is visual problems. Reason is that this fibrovascular growth can sometimes become inflamed and red. It disturbs the usual pattern of tears distribution on the eyelids. So these patients develop these symptoms, irritation, mild dryness, all these things happening. But when the pterygium is so extensive that it is pulling the cornea and it is pressing and depressing the cornea, it affects and distorts the normal congruity, I should say, that the continuity, the spherical appearance of the eyeball, and it becomes distorted. So, such types of depressions occur in the cornea because of the pulling, and this leads to the refractive errors, and the people develop astigmatism because in one angle the cornea has been pressed, has been flattened over there, while the other side 90 degree to that is having different curvature. So these things also contribute to the refractive errors, astigmatism. Well, when we talk about the management of pterygium, it starts with the conservative management, observation. There is no need to rush in routine cases for surgeries. It depends how much pterygium is there, and it is regressive, aggressive, static, what is the pattern from the history, and it should be observed, it should be seen, and lubricants should be advised, and careful observation of the refractive error should be done, whether it is affecting the vision of the patient or not, is it approaching the visual axis or not. This is, I'm talking about the routine cases of the pterygiums. But when you have such cases which are atypical, they need to be dig deep, they need to be investigated. And as I mentioned, the best modality is gold standard is incisional biopsy, which will exactly tell us whether it is pterygium, whether it is squamous papilloma, whether it is ocular surface squamous neoplasia. These things can be told us by the biopsy, by the histopathology from the pathology colleagues. They can exactly tell, and after that our exact management plan can be made. For example, if it is a pterygium, if we talk about it, as the both eyes are involved, so it has to be removed, and we have to put a conjunctival graft over there, or amniotic membrane graft, Amniotic membrane grafts have usually high chances of recurrence as compared to the conjunctival grafts. But the old traditional way of doing the bare area technique, that has to be abandoned. That is no more done because it has got very high chances of recurrence. When you clean it up, when you shave it off the cornea and the also the superficial sclera, it has a tendency to come back. It will have a recurrence, and it will be again apparent in a few years. So these are the things if we talk about the pterygium. But if it is a squamous papilloma, then we have to think about the excision, cryotherapy, use of mitomycin eye drops, FUs, all these things. If it is OSSNN, I mean surface squamous neoplasia, then we have to think about further, we have to investigate systemic examination, all these things. So it depends what is the report of histopathology. So this is not a typical case, so I came to my clinic and I thought it better to share this case with my respected colleagues and with my respected audience. I hope you'll be hopeful that it will be beneficial in their clinical practice, and I want to thank you for your presence and attendance and attention. Thank you.